And today we're going to be doing the general survey exam. This includes vital signs, pulses, and the lymphatic exam. Before we get going, I'm going to wash my hands here. How are you doing today?
I'm doing great.
Good. Do you have any questions for me?
Not at this point.
Okay. For the purpose of today's exam, we're going to talk through the beginning of the exam. The key components of the general survey are observational, so we'll be assessing these things and talking through them as we look at him. We would notice if he has any family members or significant others, as well as the caretaker, and see if he's comfortable having these people in the room for his exam. We'll also look at his general appearance, his skin color. We'll look for symmetry. We will interact with him and assess his speech. We'll see how he reacts, if he has appropriate facial expressions, if he's making good eye contact with us. We'll make sure that he seems alert and oriented, understand why he is here, and what exam he's going to have. We'll also check his mobility. As he moves from seat to chair, we'll see how they're moving. Can he use all of his extremities? Does he seem comfortable? It's a good time to notice how the patient is dressed, what their general hygiene is. Do they have good posture? As we interact with the patient, does he seem to hear us appropriately, and can he see us? Does he understand what we're doing? When we look at his stature, we want to check his hydration and his nutritional status. Are there any obvious deformities or asymmetries between his limbs or shoulders? Does he seem to be in any kind of distress? Does he seem anxious, in pain? Is the patient breathing appropriately? Now we'll move on to vital signs. We're going to be checking your pulses, your respiration, and then we'll move on to blood pressure. I'm going to locate your pulse here on the radial side of your wrist. We're going to check it for 15 seconds and then times it by 4. If there is a rapid heart rate or concern for the heart, you might actually check it for 30 seconds and times it by 2, or a complete minute. And he has a normal pulse. It's 68. We'll continue to monitor the pulse here, but actually change our attention and look at his chest. And we'll continue to time for another 15 seconds, looking at the rise and expansion of his chest and the fall. So that we get a normal respiratory rate of 16. We will then assess the other pulse, as we want to make sure that the pulses are equal bilaterally. We're not only checking the rate, we're checking the rhythm, the intensity, and if they feel symmetrical on both sides. I don't usually tell the patient that I'm changing my focus to their respirations because I don't want them to take deep breaths or alter the rate or depth of their breathing while I count the respirations. We're going to be checking your blood pressure now. So we're going to go ahead and actually drape our patient a little bit more because we'll be adjusting his poncho to expose his arm. So I'm going to just lift this up here for you, and we'll keep him appropriately draped throughout the exam. We'll position his arm slightly flexed with his palm up. We'll make sure that he's in close proximity to our equipment so that we can check his blood pressure and not have to stretch or strain for that. We will pick our blood pressure cuff, and we'll need to measure it and make sure it's appropriate. We want it placed approximately 1 inch above his antecubital fossa. And we wrap it around, and we need to make sure that the arrow is at the brachial artery and that the cuff wraps around and fits within that measurement. The arrow should be within the white line on the cuff, and his is right in the margin there. So he would be a patient that we may consider using this cuff, or we may opt to actually choose a large adult cuff for him to make sure that we don't get a falsely elevated blood pressure reading on him. This one seems to be doing okay, so we're going to have him relax. We are going to locate his brachial artery, make sure we know where it is. We are then going to go ahead and get our stethoscope ready, place it in our ears. We'll be using the bell of our stethoscope to listen. We will place it over the brachial artery. We are going to support the patient's arm so that he's totally relaxed. Tighten our air clamp. Make sure that we have good visualization of our sphygmometer. Pump the cuff up to 200 millimeters of mercury. We'll stop there when we've auscultated the first sound, pump back up 20 to 30 millimeters of pressure, and then release and listen again slowly. And then once we've heard the last sound, we'll rapidly release the remaining of the air from the cuff. Remove our stethoscope. We remove the blood pressure cuff and we let the patient know that his blood pressure is normal at 140/72. And now we're going to be moving on to checking his pulses. The first pulse we're going to check is in your neck. It's your carotid pulse, and this will be located just lateral to his trachea in the anterior triangle of the neck. We're going to check these one at a time. In the neck, it's very important that we only check the pulses one at a time because applying bilateral pressure can cause a vagal response and make the patient feel faint or ill, and we don't want to cause them any discomfort. We then will move on to the brachial pulses, so we want to expose the arm, have the patient flex their arm a little bit and relax. We are going to go ahead and actually palpate in the antecubital fossa. We'll now check the opposite side. Again, slightly flexed arm. Locating the pulse. It's important as we check pulses that we are checking the rate, the symmetry, the intensity, and making sure that they're equal. Radial pulse, again, which is on the radial side of the wrist. And now we'll be checking his popliteal pulses, which is behind the knee. So we'll move the drape, making sure we're keeping him appropriately covered. You're going to locate the fossa and use both hands and palpate the pulse in the back of the knee. It tends to be centrally located. So once we've found the pulse, again, assessing for intensity, rate, and symmetry, we'll drape the patient and check the bilateral side. Again, noting the symmetry. We'll now move on to the dorsalis pedis pulses, which are located on the top of the foot. We'll check the other side for symmetry as well. Occasionally you need to move more proximal to find the pulse, but again it should be located between the second and third toe on the top of the foot. The last pulse we'll be checking will be the posterior tibialis, and it will be just posterior to the tibia. We'll now locate the posterior tibialis pulse in the other leg. That completes the pulses in the lower extremities. So we'll move on. And actually, while our patient is still sitting, we'll go ahead and do some of the auscultation before we lay him down. So we'll get our stethoscope ready. And actually, when I move into the patient, I like to judge my proximity. So I'll step in, make sure I'm respecting his personal space. So I usually place my hand on their thigh. So we'll listen to his temporal arteries first. And we'll complete this bilaterally, listening for bruits or harsh sounds. We'll then actually move on to his carotids. We're going to ask the patient to take a deep breath in and hold it so that we can listen for bruits without having to listen to breath sounds. Take a nice deep breath in and hold it for me. Okay, go ahead and breathe. And we'll repeat this on the opposite side. Deep breath in, hold it. Okay, breathe. It's important to remind your patient to both hold their breath and breathe again. We're now going to complete checking our pulses, and we're going to ask our patient to lay down so we can complete this, paying attention again to his draping. Can you please go ahead and lay back for me? And I'm going to pull the footrest out for you. Okay, and I'm going to expose your abdomen. We are going to locate his aortic pulse, which is centrally located just above the umbilicus. We are also going to locate his femoral pulses. And we do want to make sure to maintain the patient's modesty and expose just one layer of skin here. So we're going to go in the inguinal area. Okay, and we will locate the pulse here. And this exam should only be done through a maximum of one layer of clothing. It is, however, perfectly appropriate to check a pulse with skin-to-skin contact. And again, with all the other pulses, we're checking for rate, symmetry, intensity. We'll move on to auscultation now. Auscultating the patient's aorta for bruits or abnormal sounds. That's centrally located just above the umbilicus. We will listen to the patient's renal arteries, which are located 2 to 3 centimeters laterally and superiorly to the umbilicus. A good rule of thumb is that your stethoscope is about 3 centimeters, so you can place it 1 centimeter laterally and superiorly to the umbilicus to listen to the renal arteries. And we repeat this again at the femoral artery. And we would repeat this on the other side. And that concludes our examination of the pulses. So we're now going to begin our lymph node examination, and since our patient is in the supine position for purposes of demonstration and ease, we're going to start with the actual femoral lymph nodes. We're going to ask the patient to lift his leg slightly and drop it out to the side. We are going to adjust the drape, maintaining his modesty but exposing the inguinal ligament. The superior nodes run just distal. They run horizontally along that ligament. At the insertion of the tendons here, you can palpate the vertical lymph nodes, which are the inferior inguinal lymph nodes. We would normally repeat this exam on the opposite side, but for demonstration purposes, we're going to end the exam of the lower extremity lymph nodes and move on to the upper extremities and head and neck lymph nodes. We'll let the patient relax. We're going to ask him to actually sit up. We will assist him, and we're going to push the footrest in to make our patient comfortable. Okay, and we're going to begin the exam of the head, neck, and upper extremity lymph nodes. We're going to actually be inspecting for the size, the shape, the texture, and the mobility of the lymph nodes, as well as any redness or red streaks. We're going to locate the occipital lymph nodes, which are located at the base of the neck on the bottom of the occiput. We're going to palpate bilaterally. And then we're going to move up to the posterior auricular lymph nodes, which are located just behind the helix of the ear. Moving around to the front to the preauricular, around to the edge of the jaw on the tonsillar, below the jaw to the submandibular, underneath the chin to the submental, to the anterior triangle, palpating side to side so you don't put too much pressure on the carotid. Starting back up at the occiput, and palpating the posterior cervical chain as well. Locate the edge of the clavicle and palpate the supraclavicular lymph nodes. We're now going to move on to the axillary lymph nodes, but it should be noted that if you have difficulty palpating the supraclavicular lymph nodes, you can ask your patient to roll their shoulders forward, opening the space and making palpation a little bit easier. I'm going to position myself to the side of the patient, remembering that the axilla is like a box and that I need to palpate all 4 sides of that box. I want to move his elbow out. If you are comfortable, you can palpate this area with your hand. If you would like to, you can place a glove on as well. For the demonstration, I'm actually going to adjust his drape so that you can see the palpation. I'm going to relax his elbow out a little bit. I'm going to go deep into the axilla and palpate the lateral side, the posterior wall, and the anterior wall of the chest under the pectoralis. We would repeat this exam on the alternate side as well. You want to palpate the patient's medial epicondyle and move up to the anacubital area. Again, feeling for the size, shape, mobility, texture, redness or red streaks are present. We'll now move on to the epitrochlear lymph nodes. We will palpate the patient's medial epicondyle, move up into the anacubital area, and palpate for the lymph nodes. We would complete this portion of the exam on the other side in both the axilla and near the elbow. This now completes our lymph node exam as well as our general survey exam.